Hello, and welcome to IMD in Action, a series of short video tutorials that show you just how easy it is to use the IMD platform to engage with and educate your patients so that they leave your pharmacy feeling well supported and ready to take charge of their health. Best of all, you can achieve this in a few short minutes, and all you need to get started is an internet-connected device. I'm Ashley Nightingale, Content Manager at IMD Health, and the scenario we will look at today is using IMD to educate a newly diagnosed breast cancer patient. The first demo we will look at is how to use IMD to educate about breast cancer. Once we navigate to the site, we will begin to educate a patient. First, select the Educate a Patient tile. Here is where we will collect the patient's age, gender, and email so that they can receive a consultation summary after their visit to your pharmacy. As an example, you have a patient named Carol. She is 57 years old and recently diagnosed with breast cancer. Carol was told she'll be starting on a chemotherapy cocktail, as well as she will be receiving a drug called Grastafil. Carol has been talking with friends and family about her recent diagnosis, but is looking for some more information and support from her local pharmacy. This is where you can take the time to sit down with Carol and help answer any of her questions and make her feel supported and comfortable. We'll begin by inputting Carol's age, gender, and email address, and then you will click Start. The next screen we are taken to is your personal homepage. The screen you see right now is my personal homepage that I have set up my personal shortcuts. Here you will see the pharmacy that I work with, as well as my tiles, which are my go-to topics that I tend to educate on most often. The reason I've shortcutted these is that they're one click away rather than having to search in the search bar or navigate through the body. As you can see, one of the topics on my tiles is breast cancer, and this is the topic we are going to be educating Carol on. So I'm going to click breast cancer. Once I have entered the breast cancer topic, you will see a variety of options on the left-hand menu. There are a number of diagrams to choose from. Depending on what type of cancer the patient has, it'll determine what you select. The first image, however, will show you a profile of a breast, along with an image that has a tumor involved, and this is what it may look like. Every time I select a new image, you will see that there's a square pink box, meaning that all of this information is going to be attached to an email basket. We can then supplement the information with understanding documents for Carol. Here we have a PDF on breast cancer. This will focus on diagnosing, understanding breast cancer, the staging of breast cancer, as well as treatment options. This is 15 pages long, so Carol can take this home to review at a later time. You will also see that there are 3 videos, which I think would be important to send home to Carol. One of them is explaining what cancer is. We have a coping when you're first diagnosed, as well as taking oral chemotherapy at home. A lot of patients think that chemotherapy is only injected at the hospital. However, chemotherapy can actually be taken orally as well. These are videos that are easy to understand for the patient. So all of this information that I'm clicking, I can either play for Carol now, or I could send it home for her to review at her own time. The next topic we're going to look at is on lifestyle tips. Again, we have lots of documents from the Canadian Cancer Society, which we can go through, or we could go into the Wellspring Cancer Support. This is a support system for patients in the community. Here you can see that there's a lot of information that is for patients. If we go into coping skills, these are a number of documents and videos. Here it can be the explanation about relaxation and visualization, mindfulness, maybe some yoga for some symptom relief would be helpful for Carol as she's heard about that. We can also go into a different topic such as exercise and nutrition. Here we can bring information home, so cancer exercise programs, as well as videos that can be all sent home for Carol. Finally, Carol mentioned that she was starting a new drug along with her chemo cocktail called Grastifil. She mentioned that she had a handout that talks about injecting Grastifil, however, she is still a bit worried about that. Here, if we go into the treatment options, you can select Grastifil, and here you could send Carol home a 15-minute video injection guide, and this can be reviewed at a later time. As soon as she gets home, if she has any questions, she can give you a call, but this will help answer and clarify any of the concerns she has. As well, you can send her home an injection guide and a support patient program from the Answers Company. So here's the injection guide that Carol was probably talking about, but we can send it home to her as well, so it's going to talk about the injections. As well as here's the Answers Patient Support Program, as well as an enrollment for the patient as well. So all of this can be sent home to Carol. Now that we've equipped Carol with visual, supportive, and educational materials, we will now send this all home to her. We can select the pink icon located at the top right corner. It's got a mail on it. You can see that there's 14 items that we've actually reviewed with Carol, who's a 57-year-old female. This is all of the information that we have reviewed with her. Here we can send a note. We can say, please review, and call if you have any questions. Next, we will select that we are part of Carol's healthcare team, and she has consented to us to send her this email. You can see here that because Carol gave us her email at the beginning of the session, her email actually populates here, so it's only one click away. Next, we will hit send. This will bring us back to our home screen now to educate another patient. The nice thing about that email is that Carol can review all these materials on her time. She can even forward this to friends and family. Now, Carol not only feels better, but she feels supported to know her pharmacist not only took the time to discuss her concerns, but also provided such valuable documents and videos that she can take her time to review and discuss with you if she has any questions. It's worth mentioning now, though, that this is a one-way email. So if Carol has any questions, she's going to have to call to discuss.